Hi everyone, I'm Dr. M. Niharika, working as a fertility consultant in Kamineni Fertility Center. Welcome to the Facebook live session with me, Dr. M. Niharika, on the topic of advanced treatments in infertility. Today is 25th July. We mark the 25th July as the World IVF Day because in 1978, 25th July is considered 25th July, the birth of Louis Brown, the first IVF baby, was has happened in UK. So this day we mark it as the World IVF Day, giving the preference to and in the memory of the uh, scientists who have developed the IVF process for infertility couples. So in from 1978, we have come very far. It's been almost four past decades, and there have been a lot of advancements in infertility treatment. So what basically was started as an process to help couples who are suffering from tubal factor infertility, the in-vitro fertilization, which means nothing but the egg and the sperm are fertilized in the IVF lab outside in an incubator, maintaining the temperature similar to that of the uterine environment and the tubal environment, and helping the couples to bear child who are suffering from infertility. So this was started in 1977, and later there have been many developments like helping couples who are having male factor infertility. So IVF was the basic process that had started, and that also in 1978 there were no stimulated cycles as we do today. It was a natural cycle, and the oocyte retrieval was done through a laparoscope instrument. So from that era, we have come very far to this era where we use mainly the artificial intelligence in advanced treatment and help us understand or give better success rates to the couples. So after the development of IVF to help patients with male factor infertility, where who have low sperm count or low motility, that also poses a difficulty even in IVF cases for fertilization. Then came the process of ICSI, that is nothing but intracytoplasmic sperm injection, in which each selected single sperm is injected into an oocyte inside the cytoplasm of the oocyte, so for better fertilization rates. And this achieves at least 85 to 90% of fertilization rates. This mainly is helpful in couples who have low motility and low sperm count, where IVF will have less fertilization rates. This was developed first in 1992 by the scientist G.D. Pamelo. And then after this ICSI also, there are a lot of advancements that have happened. ICSI was basically to inject the sperm inside the cytoplasm, but later also there was a development of PICSI, that is physiologically injected sperm, wherein we assess the sperm motility, even though the low motility, that also in them also we do a proper selection by subjecting them to physiological selection on terms of motility. And then came the IMSI process, that is nothing but intracytoplasmic microscopically selected sperm. This, as we know, we use a stereo microscope for ICSI, but in IMSI there has been a microscope that is used with a magnification of 6000, where each shape of the sperm is selected, and only the sperms with normal shape have been subjected and used, and this has achieved better fertilization rates compared to the ICSI as well, because at times even ICSI might not achieve proper fertilization rates. So that was the advancement. And apart from IMSI, there we also use the or help couples who have the azoospermia, where the sperm count is nil. So we can surgically retrieve the sperms and then use them through ICSI for fertilization and help the couple bear their own child. So apart from that, there have been also a lot of advancements in the stimulation protocols that we use today, because initially only the menopausal gonadotropins were used, which posed little difficulty in stimulations, and there was a lot of error and try. After that came the introduction of recombinant injections, which are highly purified and achieve better results or better oocyte stimulation compared to the previous HMG injections. And also the stimulation protocols have emerged a lot, See, now we live in an era where everybody is more in woo of natural products, organic components, and all. So we are sorry, we are again going back to the natural era where we try to do minimal stimulation and decrease the most important complications of ovarian hyperstimulation to the woman who is undergoing IVF stimulation, and also the risk of multiple pregnancy can be minimized by going around with minimal stimulation protocols. And also, apart from the stimulation protocols, the advancements in the freezing technique have helped couples to reduce the chances of ovarian hyperstimulation and also achieve better pregnancy rates compared to that of the fresh embryo transfer cycles. So because initially what was developed as a slow freezing technique for the oocyte or the embryos, now we use a very fast super cool technique that is called as vitrification, which helps better survival of the embryos after bringing back them to the normal temperature after freezing. And also there has been more advancement in terms of increasing the success rates. What's said and done, even though there are a lot of advancements happening in the last 4 decades, we still struggle to maintain or achieve that 30 to 40% success rates of IVF, because a lot is not known after the embryo transfer what exactly is going to happen inside, because we only can monitor till the day or till the time we are doing the embryos transfer, because we can see microscopically until then. But as we do the transfer, it's all presumptions and assumptions that we do, or there's no exact equipment that can see. But overall, until the time of the embryo transfer, the process, if it has gone perfectly fine, then there are high likely chances that the patient or the couple can become pregnant. So in terms of that, we are advanced in doing the embryo selection by performing the pre-implantation genetic screening on the embryos, that we call it as PGTA. That helps the couple to understand, or who patients who are having aneuploid embryos and end up having difficulty in the conceiving or failure IVF cycles. And PGTA also helps couples who are having some kind of genetic abnormality, either in the male or in the female, or they have had a child who is genetically abnormal, can also have the PGTA analysis, which will help the couple to have a child that is genetically free of the abnormality that the parents are having. This is in terms of embryo selection. And also now recent advancements or use of the non-invasive technique that we generally imply to all areas of medical field. We are also trying to assess the embryos or the aneuploidy rate in the embryos, not from the biopsied cells, which is an invasive technique, but with the non-invasive technique, that is use of the culture medium where the embryos have grown till date. That is called as spent culture medium, which helps us understand whether the embryos are aneuploid or euploid. Also, the advanced technology or the equipment that we use for the embryo selection is the time-lapse imaging. Time-lapse imaging is nothing but a scope or a camera that is kept inside an incubator, which we term it as embryoscope, where it records every event or every advanced step where we have the time when we do the embryo selection. As we naturally select the embryos by daily checking them under the microscope. This helps us to analyze at particular time or event where we necessarily want the embryo to understand, without even touching them or without even taking them out and keeping under the microscope. So that advancement has come to date, and in near future may become a routine to analyze the embryos and help us to select the best possible embryo for the embryo selection, for the embryo transfer. So this is in the terms of advancement in the IVF lab. And there is also one more advancement called as Paul scope. This is again a highly advanced technique where we assess or check the mitotic spindle that is there in the oocyte, and help us do the ICSI process better without disturbing the polar body or the mitotic spindle, which helps in better fertilization rates. So later, apart from this, there are also patients who are having nowadays we see, because of the delayed marriages and delayed childbearing, because more couples are oriented towards career, and the delay parenthood until the late 30s, where most of the couples usually turn up or have difficulty in conceiving. They end up having or trying to in them mostly the IVF cycles are done. So a couple who comes with poor ovarian reserve is more prone for going to in vitro fertilization cycles. So in them, the newer techniques like minimal stimulation protocols, more natural or modified natural cycle IVF will help us achieve better success rates by using the natural oocytes that are developing every month, and also minimal cost effective, because natural cycles we don't use much of the injections. So in that way, if we are going for pooling of embryos in poor ovarian reserve patients, it helps us to uh, achieve better success rates. Also, we try or to achieve the better success rates by doing PGTA in poor ovarian reserve patients, because we know that as a woman is increasing, in women as there is increasing age, the ovarian reserve is coming down. So when a woman reaches around 35 years, her reserve will come down, and so the quality also. So in a couple who is more than 35 years of age, we can help them understand about the PGT process and help them understand that doing PGT with the pooling of embryos will help you to achieve a better pregnancy rate when we transfer an euploid embryo. So this is in terms of the poor ovarian reserve, and apart from that, uh, then we also know that there is a lot of advancement in the cancer treatment, and therefore the survival post chemotherapy, radiotherapy, patients are having better life survival now. So as we know, cancer is a disease where the medication used for the treatment are going to damage the gametes, that is either the oocyte in the woman or a sperm in the male. So oocyte cryopreservation or ovarian tissue cryopreservation, or if the couple are married, then doing an ovarian stimulation, doing an IVF process, preparing the embryos and freezing them will help them to have a child of their own after the treatment is completed, and they are disease free. So this kind of advancement has also helped couples who are having better survival rate post chemo treatments. So in spite of all these things, in the advancements that we have in the process of IVF or ICSI, still the success rates are around 40%. So what we usually do is uh, on an overall assess the couple, and then help them understand the process, and help them select the best process for their pregnancy. So some people also suffer from the endometrial issues or the uterine issues, where it is very difficult for them to conceive in spite of having good ovarian reserve or good sperm count. So in patients who are suffering from thin endometrium, that is the endometrial lining is not quite enough for the implantation to happen, or patients who are suffering from recurrent implantation failure, we can also do advanced treatments like the ERA. ERA is nothing but endometrial receptivity array. This particular test, diagnostic test, helps us understand whether the endometrium is capable of implantation or not, and help us do a personalized embryo transfer for that couple, which will result in better pregnancy rates compared to the embryo transfer without the personalized ERA. Huh? Question? Okay. Okay. So now let's take the questions. There's a question regarding what infertility technique has the highest success rate. So see, infertility technique, or in more refined manner, the technique that has better fertility success rate is the ICSI process. But on an overall, we have to basically understand the couple, whether is it an ovarian factor or is it a male factor. So depending upon the cause of infertility that the couple are suffering from, the success rates differ. But basically, whether when we have achieved a good embryo with the ICSI process, it has helped us to give success rates or deliver success rates of at least 60% in a couple who are having difficulty in conceiving. ఇక్కడ ఒకటే కనిపిస్తుంది. So there's a question that says, can IUI cause twins? So in IUI is the process that we use or term it as intrauterine insemination. This is a process where artificial reproductive technique where the sperm is being washed or prepared in the lab and injected into the uterine cavity. This mainly helps couples who are having mild male factor infertility or cervical factor infertility, or in couples who are having decreased motility. So what we usually do is that we do an ovarian stimulation, which is a very mild stimulation to develop either one follicle or two follicles. So definitely IUI can result in twins, but the chances that IUI will result in twins is less compared to the IVF process. Questions ఏం రాలేదా? I think ఇక్కడ ఏదో ఉన్నట్టుంది. వాళ్ళని అడగండి మరి. So meanwhile, while waiting for the questions, I would like to add some more advanced treatments that are in research and which will help us serve the couples who are suffering from infertility and different causes of infertility. If we think in terms of uterine environment, sometimes even couples who are having good quality embryos, they suffer from recurrent implantation failure. So the advances in this mode of treatment can include, like, research is being done to regenerate a new endometrium in the lab that will help the patients to have pregnancy, and also uterine conditions where the couple are having very small uterus. Uterine transplantation has helped a few couples to achieve pregnancy on their own by transferring live or donor uterine into the couple who is having the very small uterus or absence of uterus. In that way, couple can have their own pregnancy. And also patients who have undergone chemotherapy, radiotherapy in home, or hysterectomy in patients who have been suffering from cancer, uterine transplantation after the chemotherapy has helped them to bear children on their own. This is in terms of the uterine causes. And there are a lot of couples now we see with poor ovarian reserve, where it's even difficult for us to achieve better results even with the IVF. So in those patients, we are trying to help them by growing the primordial germ cells, that is the cells which are in the very primitive level, in the lab by embryonic culture or in vitro maturation, where we can grow them, the oocytes, from very low stage, that is the early primitive stages, to the mature oocyte, and then fertilize them using ICSI process and achieve embryonic cells which can be transferred and then achieve pregnancies. But this is in the research lines. And also the advancements in the sperm selection also have taken place. where now in terms of using the better or best quality sperm, we are using the technique called as microfluidics, where in microfluidics is nothing but a process that helps us to select the sperms in a more natural way. Because our body, even though we are in a stable state, some amount of vibration is still going on in the body, so, or the peristaltic movement that regularly happens in the organs. So if we can mimic that peristaltic movements outside, this technique of microfluidics can help us select the best possible sperm with the best motility, and also growing or culturing embryos or fertilizing the egg and the sperm in such an environment will help us to achieve better quality embryos and better IVF success rates. So, on a note, I would take home message. What I would like to give the couples who are suffering from infertility is that there's no harm in going and having a basic consultation with an infertility consultant, but when you are having difficulty in conceiving, or just have a consultation and have a complete evaluation from both the male and the female side, so that the doctor can help you understand where the issue is, and help you understand what is the best treatment that you can undergo.